used to think, oh, those poor seniors, they have to decide between medicine and food. Never, ever thinking that I would ever be in this position.
Well, I have to cut back on certain things, that I don't have, and that's the way it is.
We've been struggling for a long time. Sometime, and I just don't like to ask people. I like to do for myself.
For more than 50 years, seniors flocked to retire in South Florida. Touted as the sun and fun capital of the world, they came to enjoy an affordable tropical life of leisure. For some of our seniors, that dream of a good life in their sunset years is fading. Instead of enjoying golf and playing cards, they're staring into bare refrigerators and cupboards, wondering where their next meal will come from. Hundreds of thousands of seniors in Broward and Palm Beach counties are living in what the federal government calls food deserts. These are places where people have trouble getting affordable, fresh, nutritious food. Some worked their whole lives. They raised families. They saved for tomorrow. They never thought they would be the ones counting pennies at the end of each month as they make out a grocery list. Or that buying a sweet potato or a lemon would be considered a luxury. Some can't bring themselves to tell their neighbors or families, or even admit it to themselves, so no one knows, and their struggles stay hidden behind closed doors in neighborhoods and retirement communities throughout South Florida. For those who do seek help, there's not enough to go around. Experts say it will take more of everything, more money, more food, and more innovative solutions, because food factors into so many aspects of our lives. As simple as it sounds, it starts with admitting there's a problem.
I think maybe part of the conversation is that a lot of baby boomers, they were the largest middle class population we've had, and I think their class status has changed over time. They've are for the first time experiencing poverty, and maybe part of the issue is part of the awareness issue is that they don't want to vocalize that they cannot have access to food because it's part of shame that they are no longer financially as viable as they used to be, or they just don't know how to actually articulate that. They've never experienced food insecurity.
The U.S. Department of Agriculture defines food deserts as areas where a third of the people live at least a half mile from a large anchor supermarket, farmer's market, or other healthy food provider, are on limited incomes and have no personal transportation. Anthony Oliveri, a Florida Atlantic University professor of urban and regional planning, uses food desert maps in his consulting work, helping communities build feeding networks.
Food deserts are places where the food environment, the neighborhood or community food environment, is not adequate for the nutritional needs of its population. So you tend to find fast food restaurants, convenience stores that do not promote or sell healthy food items. In smaller grocery stores and convenience stores, items such as lettuce or greens, they are either unaffordable, they're quite high, or they're not there at all.
In South Florida, there are 326 food deserts.
So this story is pretty important, particularly in South Florida, where we've actually planned huge mega blocks, super blocks, to house and for aging populations. But we never thought about how they acquire food. We thought about how they could play golf, but we really haven't planned, how they're going to access food, how they going to live healthily, for the rest of their lives.
How did South Florida get here? It took a perfect storm. People are living longer. Some face high medical costs. They're outliving their savings. Having a limited income makes people of all ages more likely to have trouble feeding themselves. What puts seniors in food deserts at particular risk is that they are more likely to be homebound, which means they can't get to a store on their own. Or they may be disabled, which means it may be more difficult to cook.
When you do retire, it's all about how long am I going to live and how long will whatever I have last. And you have kind of to make some bets in that regard. And most people will probably get it pretty right, but some people will get hurt.
Many people assume food deserts are only in urban neighborhoods. However, food deserts exist in our western suburbs as well. For many in these communities, food has not been an issue until now. Linda Kaplan is one of them.
It's surreal to think that I am in a position that I can no longer really take care of myself fully when I've worked so hard all my life, 7 days a week for 29 years, and was a contributing member of society. It was just like anybody else.
Linda is 76 years old and lives with her 2 cats in Sunrise Lakes, an active adult community for people age 55 and older. Linda had a comfortable life. She worked, raised her son, went to the theater with friends. She never thought she'd have to worry about having enough money to buy groceries at the end of the month. She spent most of her career as a social worker and teacher, helping others.
And I was always on the other side of the desk, and then suddenly, wow, I'm on the receiving end of the desk, and it was a little bit different.
As people live longer, they are also more likely to live alone, which means no one knows if they've had a meal at all on any given day. In Sunrise Lakes, where Linda lives, 57% of people age 65 and older are living alone.
A lot of these people came down here as a couple with 2 incomes. Now one or the other passed, and now you have one person struggling, trying to survive on their income alone. And so you have to pay your electric bill, you have to have some sort of a phone, you pay that. If you don't own a condo or wherever you're living, you have to pay a monthly fee for rent. So what are you not going to do? You're not going to eat appropriately.
Other factors were unexpected, like the Great Recession that began in 2007. Housing values plummeted, making it harder at that time for seniors to draw on their home equity. In some condo communities, property values still have not risen enough to make up that shortfall. For those who had investments, their savings suffered as well.
The seniors who were hoping to get sizable interest payments from bonds and from CDs and so on have been getting relatively small amounts, and that's probably squeezed them a bit.
Even as the economy has rebounded, many seniors have suddenly found themselves in areas where the cost of living has risen dramatically. According to the U.S. Bureau of Labor Statistics, the cost of living in South Florida is rising faster than in the nation as a whole. Meanwhile, Social Security checks have increased by less than 2% annually since 2012. In 2016, there will be no cost of living adjustment increase.
Their incomes have remained flat or have gone a little bit down. Meanwhile, the expenses around them have gone up, including the taxes that they pay. So their dollar, they're finding out, is not going as far as it used to.
Compounding the problem, the cost of medical care can eat into the grocery budgets of seniors. Gail Hillier, who lives in the large Century Village retirement community in West Palm Beach, calculates how much she'll need for her prescriptions and doctor bills before making out her grocery list every month. She has chronic respiratory problems, severe rheumatoid arthritis, and lingering mobility issues from a car accident in her teen years. Now 60, she has endured multiple surgeries, required many medicines, and seen medical bills burn through her savings.
Oh, it depleted everything. Little by little, it just depleted everything. I had some money saved up that I went through probably in a short period of time. I owned a condo and I sold that. And that money was kind of with my pension, but that's gone too now.
Linda Kaplan, who suffers from severe respiratory disorders, finds herself cutting her treatments in order to stretch her Social Security check.
And that one prescription alone is $186 and change for 1 month. I have another prescription that's a generic that is almost $98 a month. So, I had to say, what am I going to do? And so I take half of my prescription medication to make it stretch.
Eating healthy can be a challenge on several levels. Gail Hillier lives alone. That means she's not preparing meals for a family, and she's not forced to cook, something she's never really liked to do. In many cases, this leads to losing interest in having a full meal. Socializing around a dinner table encourages people to take time to eat and to enjoy what they're eating. She's also on a limited income. Gail lives Social Security check to Social Security check, about $1,200 a month. When it arrives, she pays rent and utilities. Only then can she go to the supermarket. Nutritious food is expensive. Often, fresh fruits and vegetables are the first thing to go from the grocery list.
Do you think you eat a less healthy diet now?
Oh, yeah, definitely. Because, I mean, like, I can't afford the vegetables, and I can't afford, like, if I used to keep hamburger meat in there, so if I wanted a hamburger, I could fix it, or a steak, or whatever. But now I don't.
Gail's refrigerator is mostly empty. Meals on Wheels of the Palm Beaches, a nonprofit not affiliated with federally funded Meals on Wheels programs, drops off a prepackaged meal around lunchtime every Monday through Friday. She pays $1.50 a day. It's usually her only full meal. In general, the worse a patient's diet, the higher the risk for illness and hospitalization, and even more medical bills. It can become a vicious cycle. Being underweight is not the sole indicator of malnutrition. Those who are obese can also be malnourished because they're feeding their body the wrong kinds of food. Experts say the problem is twofold. Seniors often don't understand the importance of eating the right foods as they grow older, and physicians often have little time to talk with patients about what they are eating. Medicare doesn't cover nutritional counseling except for specific medical conditions.
I think, unfortunately, it's often not necessarily overlooked by physicians, but there's not enough emphasis or there's not enough time for us to focus on that. So we gloss over the importance of nutrition and healthy diet, anti-inflammatory foods, and things like that. But we don't. We're not really allotted the time in most of our specialties to really address it at the appropriate level.
While there is help out there, it often isn't enough. Generically called Meals on Wheels, these programs usually are subsidized by nonprofit or government funds. They deliver prepared food at a low cost or free to low income, seriously disabled seniors. However, there are long waiting lists for home delivered meals. Only the most frail get priority. Another popular option, hot meal sites like the one at the Daniel D. Cantor Senior Center in Sunrise. These sites require that seniors travel to them, although some senior centers do offer transportation.
So it's very difficult for the people to access those foods where they bring them to them, and there are some. But still in all, they have to have a way to get to the food. The food isn't going to get to them, and that becomes the biggest problem.
Some seniors move to retirement communities, largely because of shuttle buses that can take them to the nearby stores. The shuttles are convenient, but many seniors are too frail to go grocery shopping by bus very often.
You know, when I go shopping, I see the buses from some of the bigger assisted living facilities waiting for the individuals to get on the bus. And when you realize how little they can carry on the bus, and some of these people are frail, not frail to the point where they need a walker, but when they get off the van that is delivering them, they're not necessarily getting assistance to get their groceries into their homes. So that's a major problem.
Food home delivery and prepared meal services are available from private companies. However, these can be expensive. Ordering may need to be done online, and many seniors don't have computers or don't know how to use them. Food pantries are another way South Floridians can stretch their food dollars. Linda Kaplan goes once a month to the food pantry run by the Soref Jewish Community Center in Plantation.
Does it solve the problem? Hell no. But does it help? Yes. And there should be more places and more aware people about it. My God, it looks like marble rye, which is beautiful. Hey, and it doesn't even have seeds. Today they were very attuned to me. I got seedless rye bread.
Some food pantries, however, may provide as little as one food box a month. Only a few offer fresh produce and meats. One of them is Gateway Community Outreach, a nonprofit feeding agency with 6 sites in Broward County and 1 in Palm Beach County. Founder Carol Ray says Gateway sees more seniors today standing in line for food.
There are a lot of new ones coming on to our sites, especially again the one in Deerfield, and it just seems to be what's happening in our country, let alone here in our community in Broward County. So it's an ongoing situation.
Gateway regularly helps all of its clients apply for food stamps through the Supplemental Nutrition Assistance Program known as SNAP. However, Carol Ray says seniors particularly are reluctant to do this. Only about half of Florida's seniors aged 60 and older who are eligible for food stamps apply for them, a lower utilization rate as compared with other age groups.
They have a hard time doing that. When you have been a professional for many years, or some of them have been in the service for many years, it's just very hard and humbling to ask for extra services and to even be a part of a program.
Part of the problem is that the application process is complicated. Social service experts say some seniors think it's not worth the trouble, as the food stamp benefit can be very minimal. It's tied to household size and income, and seniors often have small households and some Social Security benefits. Gail Hillier receives $16 a month in food stamps. Booker and Geneva Wilkins, who live in a food desert in East Boynton Beach, receive about $250 a month. Geneva was upset when her husband Booker told her he was going to apply for the benefit.
I just don't like to ask people. I like to do for myself. I like that. I like to go make my own. That's what I am. And I don't want to go to the state. They say go there. I don't want to ask them. I don't want, unless I just really, really have to.
Like Geneva Wilkins, many seniors are uncomfortable accepting assistance to fill their cupboards. Many hide the fact that their Social Security checks don't cover their food bills, ashamed to tell their neighbors or even their families.
And there is a stigma to taking help, whether it be welfare, food stamps, food banks. People look down upon it, and it's a shame. There should be no stigma. There should be none whatsoever. There are people who know me who have no idea I go to a food bank. I mean, I don't look like your person who's standing on the street corner. I know that.
Sometimes the seniors are in denial. They don't see themselves as being in need.
Mobile pantry, this is the term pantry. Pantry, that's for poor people. And if you're in a planned community, especially if you have a condo, I mean, you might have bought the condo for $20,000 20 years ago. It might have been, a status for you, and it's still a status for you. But to go to a pantry, the great, I bought this condo, I live in paradise, and now it all ends with me and my condo getting food from pantry.
Carol Ray of Gateway Community Outreach said the nonprofit several years ago approached the residents and management of Century Village East and Deerfield Beach about periodically bringing a mobile pantry to the community. The idea was to provide residents with fresh produce, fruits, and other groceries, free of charge. She says the residents liked the idea, but that management seemed hesitant.
The problem that we were running into as a nonprofit entity was that they wanted to charge us rent at that time, and we weren't prepared to pay rent because all of our sites, the 6 in Broward and of course this building too, we do not pay any rental fee at all. But it just kind of withered out. I mean, with their hesitation at that particular time of what they wanted to do and what they wanted to charge us a fee, it wasn't doable at all.
Management at Century Village East did not comment despite repeated requests. Experts say many city and community officials either don't know what food deserts are or question their existence. What else could be done? There is now a growing movement to put this issue in the public eye. Groups, including AARP and the nonprofit National Foundation to End Senior Hunger, are attempting to gauge the number of seniors that are at risk of hunger and how to reach them. One challenge? Food insecurity is seen as more of a children's issue than a senior issue.
There's nothing glamorous, there's nothing pretty about showing an old person who's starving. There is something hopeful when you take pictures of kids who need help. That's the future. But the past and the present, and it's going to get worse before it gets better.
Advocates say South Florida needs to start thinking beyond traditional options. Some organizations already are doing that. In the Wilkins' East Boynton Beach neighborhood, a nonprofit community center bought a small pickup truck known as the Senior Vegemobile. Twice a week, the center's staff loads the truck with vegetables and fruits from Palm Beach County farms, driving through the neighborhood and inviting seniors to select produce out of the truck. They didn't need anyone's permission because the neighborhood is not inside a retirement community.
We have green peppers, we have lettuce, we have sweet potatoes, tomatoes. I get great satisfaction because it's good, to help our senior citizens, because these people on low income, and it makes me feel good. I can help a senior Because one day I'm gonna be an old person, real senior, and I'd like someone to help me out. Someone take my spot and bring me some vegetables one day and help me, because I know it's hard out here.
It's really been nice to us by fruits and vegetables and stuff, bringing it out to us, and I really appreciate them because sometimes you don't have money to go buy this and buy that. You just don't have it.
Social service agencies like Feeding South Florida are using food desert maps to identify areas of need, although everyone living within their boundaries may not be at risk. The agency began periodic food distributions at the Southwest Focal Point Senior Center, near the large Century Village community in Pembroke Pines. Paco Velez, president and CEO of Feeding South Florida, said the food bank started programs targeting seniors about a year ago, after hearing that once self-sufficient retirees were having to decide between paying for food, housing, or medicines. The agency partnered up with AARP to package and deliver 1 million meals for local elders. It also routinely brings groceries and fresh produce to low-income senior housing projects.
So what we do is we work with our senior apartment complexes and senior nutrition centers in order to deliver that food straight to where our older adults are. That way they can easily walk from where they are to where their home is, or if we bring a whole slew of volunteers, our volunteers will help walk them up to their apartment with that food. So we're working with our housing programs, we're working with education, we're working with workforce development, and we're working with our senior partners to identify those areas, because there are a lot of areas, especially in those pockets where people think that they're well-to-do.
Food insecurity touches every aspect of a senior's life: their health, their financial well-being, their ability to enjoy life in their golden years.
But if everything continues along as it is, I'm going to remain poor, but functional. And what about all the people who are poor and non-functional? Who speaks for them? And we've got to do something. We really have to as a society. I think that we're measured by how we treat our weakest. And I don't think as a country we do well.
Everyone agrees we need more of everything. More funding for existing programs, more awareness, more innovative thinking when it comes to solutions. Anthony Oliveri has many ideas. He envisions a partnership between public schools and communities, where seniors could have their own urban farm patches, and students could help work them. He also suggests putting some of the sprawling acres occupied by retirement community golf courses to better use.
What would happen if we combined all the populations in these retirement communities who have a lot of land, a lot of probably underutilized golf courses, and we matched it up with younger people who are really interested in growing food, doing urban farming? It'd be a wonderful combination, I think. I think you could, with the right partnerships, you could create excellent urban farms, commercial urban farms, within the actual planned unit communities.
Experts say innovation can't happen until South Florida's community leaders, policymakers, social service providers, and seniors themselves fully understand the complexity of the problem and are willing to work together toward solutions.
You could start that conversation with how bad it is. We are suffering from food insecurity, and a lot of people are not going to want to have that conversation because of the shame. And also it's uncomfortable for politicians or decision makers because they really don't know what to do yet. It's new to them too. But a conversation about, hey, have you thought about a food enterprise for this community? It's something to just make it fun and bring an extra income into to the community. That might be a way, since we already know that they have food insecurity, that might be a way to have the conversation about food access and actually address the issue, rather than coming to them and say, we know you have no food access, and they go, okay, yeah, okay, you got me, I'm ashamed of it. Now what?